And uniqueness doesn't mean perfection. It has pro and con in the uniqueness. So we entitle our session as Health Governance Lessons Learned from Thailand. I hope you will learn all aspects of lessons that we found. And today we are honored to have the distinguished moderator, whom you will not see them often as the moderators. The first moderator is the former WHO representative to Mongolia. He is currently the director of the Center for Health Policy and Management, MAHIDOL University, Dr. Wiwat Rojanapithayakorn. Please give him applause. And the second moderator is the WHO representative to Thailand, Dr. Yonas Tegegn. Please also give him applause. And Dr. Wiwat and Dr. Yonas will decode the reflection and lessons from the speakers. So now the floor is yours.
Thank you very much. Good morning. So it's my great honor to be here today in this room and to be with all the experts in health governance. The topic for today is health governance lessons learned from Thailand. But I hope that the discussion will not be limited to Thailand, but also to other countries, other regions as well. This session that I learned that this session was prepared to commemorate the 9th anniversary of the Thai Health Commission. In Thailand, 9 is a lucky number, a special number, because the king of Thailand, the current king, is the 9th king of this dynasty. And so we always celebrate whatever that activities that we have that link with the letter 9. And so this is a very special occasion that the National Health Commission, along with or together with 3 other agencies, agree to organize this side meeting. And there are 6 speakers this morning to fill up these very interesting sessions. And I would like to invite all of them to come and sit in front of us at the beginning first. Then after that we can arrange the seat differently based on the flow of the sessions. And maybe we should, both of us should introduce them, please. Yep.
Thank you, Dr. Wiwat. By the way, it's not by deliberate intention that 2 WHO representatives are moderators. It so happened that in the past or current we happen to work for the same organization in the same post. But I believe this is probably a unique opportunity in learning from Thailand's health governance, because this is also a time where there is a debate even in Thailand of where we are heading in health governance. There is a lot we can learn, but also our Thai participants would like to be challenged as well as learn from the experience from some of you would have on this subject. And we are honored, I'm honored to be here with you and to be asked to introduce first Professor Surichai Wan-kaew, and my apologies for mispronouncing. After 18 months, I'm still struggling with almost every word I encounter. Professor Surichai is currently the director of Center for Peace and Conflict Studies at Chulalongkorn University and a member of the National Health Commission. Before taking his current post, He was the president of the Asian Rural Sociology Association, and many other responsibilities in academics, as well as other functions and committees over the years. His research interests are sociology and development, and environmentalism and sustainable development, social movement and people participation, endeavors and social theory. In addition to giving us a general view on governance, I think the organizers have given him an additional, even more difficult task than what we have, trying to summarize the conclusions.
Okay. And the second speaker is Dr. Vinai Leesmidt. He's the director of Klongklung Community Hospital, or Klongklung Hospital, in Kamphaeng Phet province. And he is well known by his studies related to the areas of health management. I will not list all the study that he has done, but I think he's the right person to talk about governance in health sector or by health. So please.
On the first part of the session, which we have divided into two, the last but then not the least is we are honored to have one of the most prominent economists, Thai economist, Professor Ammar Siamwalla. His expertise is in health financing, and he's also an expert on Thai rice, agricultural economics, and development economics. Currently, he holds a post of Distinguished Scholar of Thailand Development Research Institute. He is on the board of committee of several organizations, including an advisory board member of Transparency Thailand. He was the vice president of the National Health Financing Development Committee and chair of the subcommittee on development policies of strategy and healthcare financing and system. And we are fortunate to have his participation. Thank you.
Actually, we should clap our hands when we finish introduction of each one. So please do it in let's say backward, right? Because we already introduced the first three. Now the next one, I'm really pleased that she is sitting here because she makes something like a gender balance to some degree, because 5 persons equal to 1. No need for introduction. Professor Anne Mill is currently the Deputy Director and Provost of the London School of Hygiene and Tropical Medicine, and a professor in health economics and policy. Just by coincidence that I met her the first time how long ago? 5 years ago, when both of us received the Prince MAHIDOL Award in 2009. But we received in January, right, 2010. Yes, that was the first time I met her, but I learned a lot from her from her work, and she's a key figure in many areas, including the governance. So we are lucky to have her sitting here today to give us some important presentation about health, universal health coverage, because she's one of the external evaluators to evaluate the 10 years implementation of the National Health Secretary Office. And we would like to learn from her, because we learn a lot already from the media, and she will add her view on this very hot topic in Thailand nowadays. So thank you very much, Dr. Professor Anne Mill.
If somebody says they know about civil society and NGOs, they are bound to come across BRAC. And we are also honored by the presence of Dr. Ahmed Mastik Raz Chowdhury, who is the vice chair of BRAC, the world's largest non-governmental organization. He was previously its deputy executive director, founding director of the Research and Evaluation Division, and founding dean of the James P. Grant School of Public Health. Dr. Chowdhury is a founder of the BRAC and two civil societies, a watchdog on education and health, respectively. He is on the board of committees of several organizations and initiatives, including the Board of Trustees of BRAC University in Bangladesh and International Advisory Board of the Center of Sustainable International Development at the University of Aberdeen in UK. And he will also give us his point of view on how participatory health, for health governance by health promotion, and also he would be a good resource to tell us how BRAC develops through the processes. Welcome. And
yes, I heard a lot about BRAC. Initially, I thought it Brazil, Russia, Argentina, and China, the 4 big countries. But I just learned this morning that BRAC is Bangladesh Rural Advancement Committee. So very, very big NGO. The next speaker will be the last but very important person also is Dr. Phaiboon Turiyawong Phaisan. I'm lucky that I introduced him because it's not possible for Dr. Yonas to pronounce his family name. And actually, my family name is a little bit longer than him. And when I was WR, WR, I mean WHO rep, people said that the longest WHO representative, the longest family name in the world, and I was very proud during that time. Professor Phaiboon is a professor in Department of Community Medicine at Faculty of Medicine, Department of Community Medicine at Faculty of Medicine, Ramathibodi Hospital, which exactly the same place as my workplace. We are in the same faculty. He is very well known in Thailand on his road safety studies, health promotion, cardiovascular health studies, and also one key researcher in the health system issues in Thailand. And he is one of the external evaluation team, or in the evaluation team, to evaluate the implementation of the National Health Commission Office, the organizer of this side meeting. And so we can learn a lot also from him about his view on participatory healthy public policy. So please welcome him. And we are going to arrange like this. These 6 speakers will be divided into two sessions. The early morning session and late morning session. The early morning session will be by the first 3, and we have 20 minutes for discussions. And we will stop for 15 minutes break, and then we come back again to start the second session by the other 3. And after that, we will have also 20 minutes discussion of those 3, and followed by a general discussion, and will be wrapped up by Professor Surichai at the end. So let's start by the first presentation.
I think to be fair on that, we don't get a problem with our necks. Maybe some of us will go back while we ask Professor Surichai to do the first presentation.
And the first presentation is the concept and types of health governance. I have to confess that the word governance is it's quite new to me. I mean, in the last, I saw this first time 15 years ago, and I I was assigned to give presentation on governance, and I did not know what it was, but I accept it by accident that I say yes, whatever topic you want, I could present, and they give me governance. So I was unable to say anything, and until the day of presentation, that was in Delhi, I still have nothing to say. Even in the morning, during the first session, which was started by the introduction of the meeting. And so I wrote my presentation on, the, what do you call it? It's like they used something like transparency paper or something. So I have my pen ready to write something. But so I could be able to write 2, 3 transparent paper for that presentation in the 5 minutes later. And so that was very embarrassing situation for me. So today I just learned that today I will learn a lot about the types of governance from the presenters. So please join us. Welcome his presentations, Professor Surichai.
Thank you. It is my great honor to be with all of you. It is also very important to feel that I am sitting close to my esteemed and respected Professor Ammar Siamwalla. I say this just to put myself in a context of why do we need to talk about health governance. The reason, just from a very personal experience with Ajahn Ammar, who I never had a chance to study under him, but it was during 2004 when in Thailand we had, you would remember, that was a period where we had some very active Prime Minister. And that year we had a very quick decision that Thailand will join with Afghanistan and also the Iraqi war. Then the southern violence exploded. I say this in the context of a very dynamic world where the state, the government, is very important in running the country. But we also live in a world where the markets, where the economic competition is a very real challenge. And also we live in a world where people feel that they are part and a parcel of a wish for the better future. No one would like to leave their destiny to other people to decide. So in that context, it is enabling a moment for me to put my discussion into 3 questions. And then just to start, why governance? It is very much, in a way, in political science as well as public demonstration, this is something to be recognized only the last 2 or 3 decades, that government are not enough. We have strong government, but sometimes they do something with good understanding, but sometimes with unintended consequences, with a good intention, but yet very negative consequences which are intended, because the world is complicated. And so government alone, though necessary, but we have learned that government are not enough. We need additional concept, additional way to think about non-hierarchical way of governing. So in that sense, I would like to mention that we have learned, that societies are learning that we need to think beyond just leave things to government although government may be democratic, may be elected, and sometimes in the case of Thailand, we have a government through a coup d'etat 8 months ago, but they are, assuming they are serious and able, but yet the world is too complicated in that sense. So may I put this in the context of the globalization, where we have a system of markets, economic exchange, which is one way of the world is running. Second is the government, which in this sense we see the actor of governing is the government or the state. So we see market, state, and the other mode of governing would relate on human relationships, networks, and also interactions among organizations. This, in our studies, we would call it networks. So we would see the concepts of government that need qualification to be framed in the context of governance. And governance, in that sense, need to be seen in the beyond the government, and that needs to recognize the role of the market, the role of economic firms, etc. And we also need the role of the networks, the role of communities, the role of interactive between other units in society, communal, regional, and global. So with these 3 types of governance, 3 types of exchange, or 3 types of running society in the world, which is running mainly through the processes of markets. I do not need to emphasize that markets have extended their role to the reach beyond nation states. And we have lived in a new phase of the globalization, where this has been fully recognized in many, in the global level, in policy making level. But we also recognize that markets, including our experiences with crisis, financial crisis, including our experiences with pandemic diseases, including our the experiences with negative impact of globalization, we have learned that the actors that we call cooperation between governments alone are not adequate. So I would like to say at this juncture that we in Thailand have learned through these experiences that last 10, 15 years there have been health professionals who have been very much concerned that markets have gone beyond our capacity to regulate. Certainly Thailand had economic crisis in 1997. After that we have several civil society, including health professionals, as reforms, and that also has become a part of health reform movement, very strong in Thailand. One thinker in Thai health professionals and also public intellectual, Professor Praved Wasi, was talking about this, that health seen only as an issue dealing with disease and biophysical origin have been too passive attitude, have translated into passive attitude. So the hope to make health system more proactive in responding to deal with the impacts of globalization were much in the wish and the objective of the health professionals and Thai civil society movement. So in that sense, health, the definition of health in Thai health reform were broadened to become not only those related with diseases and biophysical origin, but to include the issue of well-being. I've just say this in the light of having our 9th year of National Health Act. And in this act, health is defined as well-being in physical, mental, social, and spiritual senses. So in that sense, health movement has become a reform movement and has been a part of Thai democratization. So the challenge, just at the end of my first presentation, I would say that the challenge of our learning the lessons from our context is what can we learn and what have we not yet been learning. My last point would relate to putting our positive lessons in the light of the present context of the last 10 years. Thailand has been quite divided. After 2004, as I mentioned to you, my experience working with Professor Ammar and Professor Pawes and Kunanan Panyarachun in the National Reconciliation Commission. I say this in the context of very polarized world, dealing with the issue of national security related to the violence in the south. And the issue was framed mainly in the national security sense. But Ajahn Ammar was one among the very important force to help to frame it in terms of well-being and human security. So I come back to the how can we see, how can we learn, and what are the lessons that we can learn in the Thai context. We can listen to other colleagues, but our context at the moment that we have entered in the last decade of very polarized. Health reform have been going in a very context of polarized polity, but can health reform become a force of more, not fragmenting, but more integrating force for the future? That is quite a challenge. Thank you.
Thank you, Professor Surichai. I think you brought some of the core aspects of it, that on one hand, the need for moving from a state-based governance is as an evolution of governance. If we look into diplomacy or international relations, from the move, we are seeing more and more move from the state-based, sovereign equality-based governance to more engagement of non-state actors in global governance. And health being defined in the Thai context to be beyond the physical and mental and going into the realm of social and spiritual. Health has allowed it to be part of the reform of governance, and when we look at it, Thailand has gained probably prominence and has, although you are self-critical that it's still a polarized and not ideal situation, compared to most countries, I think Thailand has advanced a lot in looking into the different aspects of governance, and thank you for that presentation. That will lead into the next aspect, looking into one of the sectors.
Yes, because of your introduction, Professor Surichai, we learned about different, he used the word types, I used the word the modalities by state, by market, by network. This handout prepared by the Thai Health Commission, it describes a lot about what you call the transformation of the Thai, the health governance in Thailand. and there's some description about governance by network. But other form of governance, the governance by state and governance by market, will be presented by the next two speakers. The next one will be by Dr. Vinai Leesmidt, governance by state. Dr. Vinai, please.
Thank you very much. In the governance by state here, I would like to focus on the modality about the bureaucracy system of the Thai health system. And most of the presentation here concerned with the work that I have done before. So usually it is the experience in Thailand. I use the definition of the governance here is the exercise of the political authority and the use of the institutional resource to manage the society problems and affairs. So I would like to cut off the point at the year 2000 here to before the year 2000. Actually, we have two healthcare reforms at that time. One is the Decentralization Act in the year 2000, and the next 2 years, we got the universal coverage reform. So actually, I will focus on the year after the 2000s. So what is the effect of the two types of healthcare reforms at that time? We can see at the right column is the problem system, the public system at the form before the year 2000. Actually, Thailand is in the concentration system here. So the governance at that time, we can see most of the bureaucracy system is under the control of the Ministry of Public Health. So we can divide it into 3 levels here: the regional level, provincial level, and district level. Actually, the governance of the healthcare reform happened at the regional and provincial level. So what else after the decentralization and universal coverage at that time? There were 2 systems happened. The left column is the local government system, and the middle column is about the universal system that the NSSO happened, and the NSO established the regional health office and the provincial health office. And here, I will start from the provincial level. I started study in 2007 to assess the provincial health script boards at that time because the NSO established and get the provincial office by using the public health office. So you can see at that time, provincial office act into 2 roles. The one is the office of the NSSO, and the second is the office of the Ministry of Health. And that time, we used the questionnaire to get the information from the 74 provinces. And we got the return of the questionnaire from 67, equal to 90% at that time. And the questionnaire we responded is about 638 questionnaires. It's about 86%. And we used the characteristic of the UNISCAPE at that time to assess the governance levels. We found that the governance level of the provincial health security board at that time is very high by using the self-administered questionnaire. And what else? And when we look at in detail into each characteristic, this slide shows you that the most prominent the characteristics of the governance at the time is the inclusiveness, because the inclusiveness is very high because we have at that time there was the universal coverage at that time. So what else? The lowest is the follow of the rule of law. That is the problem at that time. And what else? The consensus and the transparencies. So we can see that those three characteristics of the governance were the problems of that time. And when we touch on which factor can affect the governance level, and we found that two important factors about the attitude towards the governance of the board and the management role of the public health office were the two important factors that can influence the level of the governance at that time. Even the attitude is very high, even the management role is very high, but actually the governance, the characteristic is very low. And when we try to look at the analysis by using the quantitative data at that time, we found that the governance equations below the zero level here. We found two important problems about the governance level here is there was a gap of the knowledge and the perceptions of the members of the boards. It means that even the attitude is very high, but the member of the board at that time, they have little knowledge about the governance, and the perception is very poor at that time. And what is the role? We found the important problem about the role of the provincial public health at that time. There was a big conflict of the role between the purchasing role and the providing of the health care. And it led to the governance gridlock that we can see. So when we look at the implementation of the universal coverage at that time, we found there was a big chaos at provincial level. What else about the governance by the state? The big level about the governance that run by the Ministry of Health and the state or the government organizations. We look at the regional level. The governance there happened by using the word area health. Area health commenced by three organizations at different periods. By the NHO at the first, and the second one is the Ministry of Health, and then the NHCO, National Health Commission. The area health is used at the same name, but different meanings at all. So it led to the different interventions. It used the same geography or geographical area, but the area health have different roles and mechanisms. So this is the model of the NHO at times. You can see in this model there is the market mechanism, including bureaucracy system and also the networking altogether. It's different from the Ministry of Health. The model of the Ministry of Health is very simple, but very difficult to do. Why? I can summarize in this table. Actually, there are three organizations try to use area health implementation in Thailand. It commenced in 2010, followed by 2013 and 2015. But there are different projects in different areas and different concepts. You can see the concept here. The NSO uses the concept of the commissioning concept. When the Ministry of Health used the regional health service by using the area management. At the same time, NSCO tried to use the area function participation concept. So you can see the difference between different concepts. And 3 organizations use different mechanisms. They have different boundary and different components of the board. That's why the role of the board are totally different. So you can see the evaluation of the health system governance here. This is before the year 2000, and then followed by after the year 2000. And we hope maybe in the future that we expected will be here. There was the board of the governance here. So that's all the experience from my study. Thank you very much.
I like the part where you have showed the challenges and the different, although for the same purpose, the approaches and the philosophies behind the different partners is creating a challenge in harmonization. I think that would be an interest which probably would raise some discussion later on.